Hi everyone, I'm Picky expert Dr. Ellie Reyes, an aesthetic doctor from the Philippines. So Picky is a skincare app that is also a skin-loving community that is focused on providing you with the science behind skincare so that you can find and discover what's best for your skin. So in today's video, I'll be answering some of Picky community's burning questions. We received hundreds of questions, but today we will begin with the most upvoted one, which was from Picky user Daisy Sunny. So she asked, I saw some people on social media shave their facial hair. It's not beards or mustaches, but the fine hairs on our face. It's really confusing me. Is it really necessary? What are the pros and cons of face shaving? So in order for us to be able to answer this question, we will be talking about dermaplaning. So what is dermaplaning? Dermaplaning is a cosmetic procedure done in clinics and medical spas that includes or involves scraping the skin with a surgical scalpel to remove the dead skin cells and fine hairs on the topmost layer of the skin. Do know that there are different sizes and shapes for the blades, and the blade that is used for dermaplaning is very specific. So they use 10R, 14, and 10. The reason for the specific size and shape is so that you do not cut your skin. So what are the benefits of dermaplaning? The number one reason why people do this is because they want to get rid of the fine hairs or the vellus hairs on their face. The internet refers to this as the peach fuzz. For some, this peach fuzz is very fine or very thin that it's almost not visible to the naked eye. But there are those who suffer or who are very bothered by their vellus hairs that it's so thick and it's aesthetically bothersome for them. So they feel the need to have it removed. Well, this is all okay, but do know that vellus hairs are actually there to protect us and to keep us warm. There are those who ask that if we do dermaplaning, will it make your hair thicker or will shaving make it thicker? The answer to that is no. Shaving does not thicken it, does not make it darker, nor does it affect the hair growth. It's just really the tip of the hair after shaving, it becomes blunt, so it looks thicker. So the number two reason why people do this is because they want to get rid of the superficial layer of dead skin. So by doing this, their skin looks brighter. They're able to make the skincare products penetrate better, and they're able to put on makeup easier, or it's easier to blend in some makeup. So you can do this once monthly so that it gives your hair adequate time to grow. So what are the contraindications? So dermaplaning is not for everyone. If you have acne breakouts, it would be best to postpone first because dermaplaning can cause cuts in your pimples that can delay the healing of your skin. Number two is if you have cold sores. It would be best to treat your cold sores first because dermaplaning can create micro tears in your skin and spread the virus. And number three, it's not really a contraindication, but more of the expectations might not be met. So when you have hirsutism or when your follicles are hormone sensitive, your vellus hairs can change to terminal hairs. So they can be thicker than usual. So it would be best if you could see your OB-GYN first or your endocrinologist to identify if you really have hirsutism or to address hirsutism first. So what can you expect after the procedure? So you can expect redness and itchiness, especially if your skin is very reactive or sensitive, which is why it's best for you to wear a moisturizer On the first 3 days, it will relieve the redness and itchiness, and it will also keep your skin hydrated. You might also want to wear some sunblock every morning because dermaplaning can make your skin more photosensitive. So yes, dermaplaning is great if you want your skin to look brighter or if you want the skincare products to be absorbed better. However, if you have problems that you really want to address, like your skin texture, or the imperfections, or your clogged pores, chemical exfoliation is still the holy grail. So what are the chemical exfoliators? So the more popular ones are your alpha hydroxy acids and your beta hydroxy acids. Your alpha hydroxy acids are water soluble and they are limited to the upper layer of your skin. So they work by reducing the phosphate and the sulfate groups on the surface of your skin, decreasing the cohesion of your skin cells, which we call exfoliation. So the most popular hydroxy acid or alpha hydroxy acid that we know is the glycolic acid. It has the smallest molecular weight, meaning it can penetrate your skin faster. So which is why it's very important that you choose the concentration and the medium. So if you have sensitive skin or if you have rosacea, you might want to go for the gel-based ones because the delivery of your glycolic acid is slowed down. And if you have normal to dry skin, you might want to go for the cream or lotion formulations because it has added moisture. And third is if you need a stronger dose of your glycolic acid, you might want to go for the liquid formulations because the delivery of the ingredient is faster. So the other kinds of alpha hydroxy acids are your lactic, which comes from sour milk. It has very good hydrating properties, so it's very good for those who have dry skin. Another is your Mandelic acid, which has the largest molecular weight, so it's very good for those who have sensitive skin types because the delivery of the ingredients is slower compared to the other hydroxy acids. Another is your Azelaic acid, which has both anti-inflammatory and antibacterial properties, making it a good treatment for inflammatory acne. So your other hydroxy acids that are usually combined with other actives are your citric, tartaric, and malic. So on the other hand, your beta hydroxy acids can penetrate deeper compared to your alpha hydroxy acids. They are oil soluble, meaning they can cut through oil, which is why they are a very good adjunct when it comes to treating acne and for reducing the appearance of your blackheads. So the most popular one is your salicylic acid. So if you want to begin with your chemical exfoliators, just make sure that if you have moderate to severe acne, it's still best for you to see your dermatologist because she would know the administration of your chemical exfoliator and she would know how to combine it with your other prescription medicine. Otherwise, you can start 1 to 2 times a week, like treat it as a mini facial, and then once your skin gets used to it, for 2 to 3 weeks, then maybe you can increase it gradually to 2 to 3 times a week. Just make sure that if you have outdoor activities, make sure that you just discontinue it first 2 to 3 days prior to the activity so as not to burn your skin. So that's all for today, guys. Let me know in the comments down below if you have other questions for me, and we might make a future video on it. So if you want to learn more about the science behind skincare, don't forget to download the Picky app or follow Picky on Instagram. You can find the link down below. Don't forget to like, subscribe, and hit the notification bell so you can stay up to date on Picky skincare videos. Thank you!